Good afternoon everyone, my name is Ravi Sharma and I work here at the Royal Pharmaceutical Society. This is just a short video to give you a daily update on the latest developments but the work that we're doing on behalf of the profession. Before I go into that, I would like to say a massive thank you to you and your teams for all the incredible work that you're doing on the front line currently. Pharmacists, their support teams, volunteers and all healthcare professionals working across the entirety of the NHS are doing an absolute phenomenal job, and without you we will not be able to support the public in the proactive way that we're able to currently. Some of the work that we've been doing here at the RPS today has been updating various resources, extra support tools and information guidance to help support you and your teams on a day-to-day basis. Some of the key updates we've been doing is around updating our COVID-19 hub page on the Royal Pharmaceutical Society's website. Key information that's been updated is guidance on recognising symptoms of COVID-19, updated advice on home self-isolation, a brand new section on new FAQs, and particularly some of the common questions around non-steroidal anti-inflammatories and COVID and other drugs, for instance, such as cardiovascular drugs and that. Advice on electronic repeat dispensing, some well-known guidance has been published there and some best practice examples of how you could implement that locally. And updated areas on some of the work that we're doing around our policy ask and lobbying for government and the NHS. In terms of the lobbying ask at the moment, they're being refreshed on a day-to-day basis as new information develops and new information is being provided to us. Some of them that have been updated in the three really important ones are, firstly, to ensure that pharmacists and their support teams are included in the government's definition of key NHS workers following the Prime Minister's announcements on school closures from Friday across Great Britain. This is vitally important that for many frontline staff, in particularly pharmacists and their support teams, in order to maintain current service delivery and demands from the public around the COVID-19 pandemic. So it's really important that they're included for this. We're also lobbying to ensure that frontline staff are protected against COVID-19. This means that they need to have adequate and high quality PPE, so personal protective equipment, ensuring that pharmacists and their support teams are provided with COVID-19 testing as a priority when appropriate and when needed. We're also asking the government to do more to support the mental health and well-being of our frontline clinicians, particularly during these challenging times. These challenging times have lots of psychological impacts on individuals, and it's really important that the government supports people during this time. Thirdly, we're also asking for indemnity insurance support for pharmacists, their support teams and return to workers to cover any activity related to the COVID-19 pandemic, whether it be NHS funded or state indemnity backed. Just some key messages from us as well. These are unprecedented times and we understand how tricky it is out there at the current moment. We're listening from members and the profession, and you all are doing an absolutely incredible job on the front line. We're all, in certain situations, working out the normal rules that we're normally traditionally used to, or whether it be packing down paracetamol, increasing capacity in critical care, mobilising staff through different clinical settings to help deliver current demands and deliver a continuity of service. However, there are some rules that still do apply by keeping patients and the public at the centre of everything that we do. We are proud of the stories and the lengths that pharmacists are going to help support members of the public on a day-to-day basis. It's absolutely incredible and phenomenal. Most importantly, during these times and overworking and working as hard as you possibly can, it's really important that you keep yourself and your team safe as best as possible. Make sure you're taking rest breaks, make sure you're supporting each other the best way you can on a day-to-day basis. We are in listening mode, and any ideas, suggestions you have, please let us know. Anything that from the next coming days which will be useful, the next few weeks, the next months, keep feeding those ideas. We would like to try and support you the best way we can. We're absolutely here for you. So thank you once again. You're doing an absolutely amazing job from the bottom of our hearts. Please stay safe and keep well. Thank you.